Prostate cancer, a disease that affects millions of men worldwide, yet many remain unaware of its early signs. Early detection is vital because it can mean the difference between successful treatment and life-threatening complications. Today, we're diving into an important topic, prostate cancer. Whether you're here for yourself or a loved one, this information is essential. Let's empower ourselves with knowledge to take control of our health. Now, let's get started. The prostate is a small, walnut-shaped gland in men, located just below the bladder and in front of the rectum. It plays a crucial role in male reproductive health by producing seminal fluid, which nourishes and transports sperm. Prostate cancer begins when cells in the prostate gland start growing uncontrollably. It's one of the most common cancers in men, particularly those over the age of 50. While some types of prostate cancer grow slowly and may not require immediate treatment, others can be aggressive and spread quickly. This highlights the importance of early detection and understanding the signs and symptoms. Recent research has shed light on the significant impact of early detection in reducing prostate cancer mortality rates. A groundbreaking study published in The Lancet Oncology emphasized the role of prostate-specific antigen, or PSA, testing and identifying prostate cancer at an early stage. Another study from Cancer Epidemiology highlighted the benefits of regular screenings, showing a 30% reduction in advanced stage diagnoses among men who underwent PSA testing. Furthermore, lifestyle factors like diet and exercise are gaining attention. While the link between nutrition and prostate cancer risk remains under investigation, several studies suggest that diets rich in fruits, vegetables, and omega-3 fatty acids may lower the risk. Advancements in imaging and diagnostic tools, such as multiparametric MRI, are also revolutionizing how we detect and monitor prostate cancer, providing more accurate and less invasive options for patients. Early signs and symptoms. Identifying the early signs of prostate cancer is critical, as the disease often develops silently, with subtle or even no symptoms in its initial stages. This is why paying attention to potential warning signs and understanding what they could indicate is so important for timely diagnosis and treatment. Here are the key symptoms you should never ignore, explained in greater detail. 1. Frequent urination, especially at night. Frequent urination, medically known as nocturia when it occurs at night, is a common early symptom of prostate issues, including prostate cancer. Men may find themselves waking up several times during the night with an urgent need to urinate. This happens because as the prostate enlarges due to cancerous growth, it can press against the bladder or urethra, disrupting normal urination patterns. While nocturia is also associated with conditions like benign prostatic hyperplasia, BPH, it is important to seek medical advice if this symptom persists, as it could indicate a more serious underlying issue. 2. Difficulty starting or stopping urination, a weak or interrupted urine flow. Men with prostate cancer may experience trouble initiating or maintaining a steady stream of urine. This difficulty occurs because the prostate surrounds the urethra, and any abnormal growth within the gland can narrow the passageway, leading to reduced flow. In some cases, the flow may stop abruptly midstream and require extra effort to resume. A weak or interrupted urine stream can feel frustrating, but it's a telltale sign that the prostate gland might be obstructing the urinary tract and warrants immediate attention. 3. Pain or burning sensation during urination. Experiencing discomfort or a burning sensation while urinating. A symptom known as dysuria is another warning sign. This can result from inflammation or irritation caused by the cancerous growth pressing on surrounding tissues. While pain during urination is more commonly linked to urinary tract infections, UTIs, or sexually transmitted infections, STIs, it is important not to dismiss this symptom. Persistent discomfort should always prompt further medical evaluation to rule out prostate cancer. 4. The feeling of incomplete bladder emptying. A frequent complaint among men with prostate cancer is the sensation that the bladder hasn't fully emptied, even immediately after urinating. This occurs because the prostate's enlargement can obstruct the flow of urine, preventing the bladder from completely emptying. This symptom may lead to secondary complications, such as urinary retention or infections, and should never be ignored. Over time, incomplete bladder emptying can cause significant discomfort and affect overall urinary function. 5. Blood in urine or semen. Finding blood in urine, hematuria, or semen, hematospermia, is less common but is a serious potential warning sign of prostate cancer. The presence of blood often indicates that cancerous cells are affecting blood vessels within or near the prostate gland. Even small amounts of blood should not be ignored, as this could point to cancer or other serious conditions, such as a bladder or kidney issue. Immediate medical consultation is necessary to determine the exact cause. 6. Pelvic pain or discomfort, particularly in the lower back, hips, or thighs. Unexplained pain or discomfort in the pelvic region, including the lower back, hips, or upper thighs, is another symptom to watch for. Prostate cancer that has spread beyond the gland to nearby tissues or bones often presents as chronic or dull pain in these areas. This symptom can be mistaken for muscular or joint pain, but if it persists or worsens, it could signal an advanced stage of prostate cancer and should be addressed promptly. Why you should never ignore these symptoms. It's important to understand that these symptoms are not exclusive to prostate cancer. Many of them are also associated with non-cancerous conditions, such as 1. Benign prostatic hyperplasia, BPH, a common, non-cancerous enlargement of the prostate that can cause similar urinary symptoms. 2. Urinary tract infections, UTIs, infections of the urinary system that can lead to pain or burning during urination. 3. Prostatitis, inflammation of the prostate gland, often caused by bacterial infections, which can mimic some of the symptoms of prostate cancer. It's important to note that these symptoms can also be caused by benign conditions, such as an enlarged prostate or urinary tract infections. However, they should never be ignored. If you experience any of these signs, consult your doctor for further examination. Causes and risk factors. Prostate cancer does not have a singular, identifiable cause. Instead, it results from a combination of genetic, environmental, and lifestyle factors that increase the likelihood of abnormal cell growth in the prostate gland. Let's take a closer look at the most significant risk factors. 1. Age. Age is the most significant risk factor for prostate cancer. The likelihood of developing prostate cancer increases dramatically after the age of 50. According to studies, about 60% of prostate cancer cases are diagnosed in men over the age of 65. As men age, cellular changes in the prostate gland become more common and DNA mutations can accumulate, increasing the risk of cancerous growth. For this reason, regular screenings become increasingly important as men grow older. 2. Family history. A man's family history plays a critical role in determining his risk of prostate cancer. If a first-degree relative, such as a father, brother, or son, has had prostate cancer, the risk is more than doubled. The genetic component may involve inherited mutations, such as those in the BRCA1 or BRCA2 genes, which are more commonly associated with breast cancer but can also increase the risk of prostate cancer. Additionally, having multiple family members affected by prostate cancer or related cancers, such as breast or ovarian cancer, further elevates the risk. Men with a strong family history of prostate cancer should discuss early screening options with their healthcare provider. 3. Race and ethnicity. Race and ethnicity significantly influence prostate cancer risk. African American men, they are 60 to 70% more likely to develop prostate cancer compared to other racial groups. Additionally, prostate cancer in African American men tends to occur at a younger age and in more aggressive forms. Hispanic and Asian men, they generally have a lower risk of prostate cancer compared to white men. The reasons behind these disparities are complex and may involve a combination of genetic, lifestyle, and socioeconomic factors. This data underscores the need for targeted education and screening programs within high-risk populations. 4. Dietary factors. Emerging research suggests that diet may play a significant role in prostate cancer development. Men who consume diets high in red meat, processed foods, and high-fat dairy products are at an increased risk of developing prostate cancer. These foods are often associated with higher levels of inflammation and oxidative stress, which can contribute to cancer cell growth. In contrast, diets rich in fruits, vegetables, and omega-3 fatty acids found in fatty fish, have been linked to a reduced risk. Specifically, cruciferous vegetables like broccoli, cauliflower, and kale contain compounds believed to have anti-cancer properties. By adopting a healthier, plant-forward diet, men can potentially lower their risk and improve overall prostate health. 5. Hormonal changes. Hormonal imbalances, particularly elevated levels of testosterone and related hormones like dihydrotestosterone, DHT, may contribute to prostate cancer growth. Testosterone fuels prostate cell activity, and abnormally high levels can encourage the proliferation of cancerous cells. This connection is particularly relevant in men undergoing hormone-related treatments or those with certain genetic predispositions affecting hormone regulation. Understanding hormone-related risks can guide preventative strategies, including regular monitoring of hormone levels in at-risk individuals. 6. Environmental exposure. Environmental factors, such as exposure to specific chemicals or toxins, can also increase the risk of prostate cancer. Men who work in industries involving pesticides, cadmium, a heavy metal used in battery production, and toxic industrial chemicals may have an elevated risk due to prolonged exposure to carcinogens. Studies also suggest that men exposed to Agent Orange, a herbicide used during the Vietnam War, have a significantly higher chance of developing aggressive prostate cancer. Environmental exposure highlights the importance of workplace safety and awareness of potential hazards in one's environment. What are proactive steps you should take? Understanding these risk factors empowers men to take proactive measures to protect their health. Steps to reduce risk include maintaining a healthy diet and weight, regular exercise to improve hormone balance and reduce inflammation, discussing family history and genetic predispositions with a healthcare provider, avoiding known environmental hazards whenever possible. Although not all risk factors are within your control, making lifestyle changes and seeking early screenings can significantly improve your chances of prevention or early detection. By staying informed, you can take control of your health and reduce your chances of developing prostate cancer. Diagnosis of prostate cancer. Diagnosing prostate cancer involves a series of tests and procedures, including prostate-specific antigen, PSA, test, a blood test that measures PSA levels. Elevated levels may indicate cancer, though they can also be caused by other conditions. Digital rectal exam, DRE, a physical exam where a doctor feels the prostate for abnormalities. Imaging tests, ultrasound or multiparametric MRI can provide a clearer view of the prostate. Biopsy. If cancer is suspected, a biopsy involves taking small samples of prostate tissue to confirm the diagnosis. These tests, combined with your medical history, help doctors determine the best course of action. Treatment options. Treatment for prostate cancer depends on the stage and aggressiveness of the disease, as well as the patient's overall health. Options include 1. Active surveillance. For slow-growing cancers, doctors may monitor the condition closely without immediate treatment. 2. Surgery. A radical prostatectomy involves removing the prostate gland and surrounding tissues. 3. Radiation therapy. High-energy rays are used to target and kill cancer cells. 4. Hormone therapy. This treatment lowers hormone levels to slow cancer growth. 5. Chemotherapy. Often used for advanced stages, this treatment targets rapidly dividing cells. 6. Immunotherapy. Emerging treatments harness the body's immune system to attack cancer cells. Each option has its benefits and potential side effects, so it's important to work closely with your doctor to choose the best plan. Prognosis. The outlook for prostate cancer patients has improved significantly over the years. Early-stage prostate cancer has a 5-year survival rate of nearly 100% thanks to advancements in detection and treatment. Even in advanced stages, modern therapies can extend life and improve quality of life. Remember, the key to a favorable prognosis is early detection, regular screenings, and a proactive approach to health can make all the difference. Conclusion. Prostate cancer doesn't have to be a silent threat. By understanding the early symptoms, risk factors, and treatment options, you can take control of your health and safeguard your future. If you found this video helpful, share it with others. Together, we can spread awareness and save lives. This is Dr. Ethan Brooks. Thank you for watching, and remember, Your health is your greatest wealth.